My presentation is on melanoma. Melanoma is a skin cancer that develops in the melanocytes, which are the pigment cells present in the skin. It can be more serious than other forms of skin cancer because it can spread to any other parts of the body and cause serious illness and death. Melanoma can be located anywhere on the body. Signs of melanoma include new spots on the skin or a change in size, shape, or color of an existing mole. The ABCD rule is another way to recognize abnormal growths that may be melanoma skin cancer. A is for asymmetry, a mole that has an irregular shape or two different looking halves. B is for border. Irregular, blurred, rough, or notched edges may be signs of melanoma. C is for color. Most moles are even in color, brown, black, tan, or even pink, but changes in the shade or distribution of color throughout the mole can signal melanoma. D is for diameter. Moles larger than a quarter inch across may be suspected, although some melanoma cancers may be smaller than this. Melanoma is most often caused by too much exposure to the sun's UV rays. Examples of this include having had blistering sunburns at any time of your life, getting intense sun exposure every now and then. Things that make getting melanoma more likely include your skin type, the color of your hair, and the color of your eyes. Here are some pictures of benign and malignant types of moles. Once melanoma is suspected, there are several types of biopsies used to diagnose and stage melanoma. They are punch, excisional, and incisional biopsies. The type of skin biopsy you will undergo will depend on your situation. Most doctors prefer to do a punch or an excisional to remove the entire growth whenever possible. However, incisional biopsies will be performed when other techniques don't work, such as if the mole is very large. During a punch biopsy, your doctor will use a tool with a circular blade. The blade is pressed onto the skin around the suspicious mole, and a round piece of skin is removed and sent for testing. In the excisional biopsy, the entire mole or growth is removed, along with a small border of normal appearing skin, and sent to the lab for testing. In the incisional biopsy, a small amount of tissue is taken to identify the makeup of a lesion or abnormality. Once the sample is collected, it is taken to the lab. After melanoma has been diagnosed, doctors will want to determine the stage of the cancer. To do this, they will determine the thickness of the melanoma by looking at it under a microscope and measuring it with a special tool called a micrometer. The thickness will help doctors come up with a treatment plan. Doctors will also want to check for the spreading of cancer in the body. To do this, a sentinel node biopsy will be done. During this biopsy, dye is injected into the area where the melanoma was removed. The dye flows to the nearby lymph nodes. The first lymph node to absorb the dye is removed and tested for cancer cells. If the node is clear, chances are that the cancer has not spread. Stage 0 skin cancer means that cancer cells are confined to the epidermis, the top layer of the skin, and have not spread. At this stage, the cancer is usually cured by surgery. Stage 1 skin cancer means that the cancer cells have grown deeper into the skin, but have not spread to the lymph nodes or any other parts of the body. Stage 2 skin cancer means that cancer cells have grown deeper into the skin or have more high-risk features but have not spread to the lymph nodes or beyond. Stage 3 skin cancer means that the cancer cells have spread to nearby lymph nodes but not to distant organs. And Stage 4 skin cancer means that the cancer cells have spread beyond the skin and regional lymph nodes to distant organs such as the liver, lungs, or brain, or distant lymph nodes and areas of the skin. So because melanoma can spread to anywhere in the body, CT, PET scans, and MRIs are used to check for that. MRI focuses more on the brain, while CT and PET look for metastases everywhere else in the body. On a positive note, there are some treatment options for people with melanoma. Surgery. The entire melanoma is cut out along with a border of normal appearing skin. There's chemotherapy, which uses medicines to stop or slow the growth of cancer cells. There's immunotherapy, which uses medicine to help your body's immune system fight the cancer. And there's target therapy with inhibitors. These are medicines that inhibit or prevent cancer cells from growing by blocking signals of the cells. Inhibitors are only given if a gene test shows that the person has a BRAF gene or mutation. In July 1977, Bob Marley was diagnosed with malignant melanoma under the nail of his toe. He turned down doctors' advice to amputate his foot due to religious beliefs. The cancer then spread to his lungs and brain, and on May 11, 1981, Bob Marley passed away. His final words were, "Money can't buy life."
There's a natural mystic flowing through the air. If you listen carefully,